Hi, Tori.
Today, I'm going to be teaching Brian how to start IVs properly. So Brian, we start IVs on patients who potentially need fluids or other medications. I don't personally start IVs unless I'm going to use them in the back of the ambulance, because sometimes when they're done out of hospital, they don't like to keep them for prolonged periods of time. So I only use my IVs if I'm going to use them, and I only do the skill. So the skill can only be performed by AEMTs and paramedics. EMT basics cannot perform this skill. It's outside of their scope of practice. So we do this pretty regularly on the ambulance, and we're gonna learn how to do it correctly and proficiently today. So the first thing we have to do is do vein selection, and I think this is the important part, if not the most important part, of starting IVs. Every provider picks a different vein. Personally, I like to pick ones that are straight. As you can see, our patient here is very vascular. He's got a lot of veins going down. Some of them are twisted and turned. Our catheters that we're going to be using on our needles are straight. Okay. So it's important to pick one that you think you can fit the catheter into. We do these IVs on extremities usually, Okay, so once you've chosen your vein and your site, you're going to tell your patient what we're going to be doing today. So I would say, hello patient, my name is Tori. Today we're going to be starting an IV. I'm going to start by prepping all my information and all my stuff, and then we will go ahead and proceed with the process.
Okay.
So there are 4 things you need with the way our setups go. An IV start kit, a catheter, an extension set, and a flush.
Okay.
So let's start by getting a closer look at all of these things. Also, always need to wear your PPE. Gloves are extremely important, and keeping the whole area clean and aseptic is important because we're going to be making a hole from the outside of the skin into the person's vein. As you recall from cardiology, veins are what take the blood back to your heart. So we're always going to point our IVs in the direction of the heart. Personally, I like to do all of my setup prior to starting to touch the patient. So first we're going to start by prepping our extension set. This is our extension, the long plastic piece. It has a Lorlock tip end, which screws into your saline lock. And then the other end is where your catheter is going to attach to. So you have this hub you can pull down and spin for ease, but don't touch what's underneath this part, and I'm going to instruct you to leave that on until you're ready to connect it to your catheter, but for demonstration purposes, I'm going to show you what it looks like underneath. So the catheter will come up and attach to this point, and you will twist this on, okay? It's important we keep it clean because, like I said, we're making a hole through the skin, and that's going to go directly onto the catheter, okay? So when you are setting up your lock, you're going to check your flush. It says 0.9 sodium chloride injection, and that's exactly what we're looking for. We're then going to check that it's in date. This one expires on February 28th, 2023. There's nothing abnormal or floating inside of my IV solution, okay? Okay. So it looks ready to use. You can either squirt it out into the air, this little air bubble, and get rid of that, or you can attach it and then push the air bubble out the top. Personally, I usually squirt. Okay, so then if there's still any air left, even if you do that, you can just hold it up and press the air bubble all the way out. And you can see the line of fluid, right? Yep. Going all the way out, and then when you start to get some drips, you know it's ready. See, there are no bubbles in the line. This is important because we don't want to introduce any air into our patient's bloodstream. So that's ready. We can set it down into the side. The next thing we're going to open is our IV start pack. Here we have a chlorhexidine pad for sterilization and cleaning the area. It's an antiseptic solution. We have our tape, which will help secure the catheter, as will our Tegaderm. We have gauze, in case there's any bleeding or we need to discontinue our IV. And then there's a label for date and time and gauge. I don't know many providers that use this, but if you would like to, you can do that, and the people at the hospital will know when you put it in, and if I said like they would want to take it out later, they'll know how long it's been in for. The last thing in here is our tourniquet. This is a long piece of plastic, and just stretch it out a little bit before you wrap it around their arm. So I'm gonna prep my other things, and then we're going to start the process. For me personally, I like to add a little bit of a lip to the Tegaderm so it's easier to grab when you're going to put it on the patient. I pre-cut my tape, making about a 5-inch thing. I then split it in half to wrap around, and I'll show you how I do that later. I put it on the back of my hand. Some people put it on tables. Whatever works for you. You're gonna find your groove. It also depends where you are in the ambulance. I did another little piece, and we'll use that in the end. So the first thing we do is, as we talked about earlier, the most important, vein selection. So today I'm going to use this vein. It's very long and bouncy. You can feel it on the arm if you'd like.
Ooh, that's bouncy.
It is bouncy. And what's important too is that I can't really push it when I push to either side, so it's not gonna move when I try to stick it with the needle.
What do they call that when it goes to the side? Is that rolling?
Yeah, it's when veins roll. And you can use veins that roll, but sometimes you need to put your finger next to it, or just choose a part that's more adjoined to a tendon so that it doesn't move as much. Veins that roll are usually more towards the surface too. So first we're gonna clean this area, and I'm making circles and I'm pressing pretty hard on the skin to try and clean it. Make an aseptic area. While that's drying, I'm gonna take my tourniquet and I'm gonna put it around the arm. So you're gonna stretch it, pull, then you're gonna make a little loop and pull it through just like that. So I'll show you one more time. Stretch, pull, make a little loop. This is so we can pull it off really easily after we put the catheter in.
Okay.
So next we're gonna be talking about catheters. This is a catheter and a needle. We're gonna open it up. Notice I said catheter and needle. They're separate, but they're joined together, two different things. The needle is what's going to puncture through the skin. The catheter is what's gonna stay behind. So on our needle, this is a 20 gauge, and you know that because it's pink. You're gonna choose your catheter, which have different colors, based on the size of the vein you've selected and what you're gonna be giving. For example, if you need to give a lot of fluids really fast to a trauma patient, you're going to choose a smaller number catheter, versus if you're just doing it KVO, you can choose a smaller number catheter, a larger number catheter. Yep.
So the higher the number, the bigger the catheter?
The higher the number, the smaller the catheter.
Okay.
So a 14 gauge is a larger hole than a 22 gauge would be.
Okay.
Okay. So on here, we have our area that collects flash, the collecting chamber right here. We have a protective covering. We have the needle, which is silver, and we have the catheter and the hub, which is the pink, and then do you see that little clear line?
I see that.
Yeah, that's the part that's gonna stay in the patient. So it's very important we're not touching from the color up, because we need to create that aseptic area.
Okay.
When you start your IV, you're gonna hold it on the sides, and when you flick this little piece forward, when you've decided you've had good placement, the needle will come down into this back part to keep you safe, okay?
So it'll push the catheter off the needle.
Yes, it will push the catheter entirely off the needle. As you can see, it pushes it up when you do that.
Okay.
So when you're ready to start this IV, you're gonna just make sure this twists. You're not gonna push it up and down very much, and you're gonna make sure there's nothing on the needle, nothing looks abnormal, because you wanna have a good puncture, and if there are spare pieces of metal, it's not safe to be using in our patients.
Okay.
So when you're ready to start an IV and the area has dried, you're going to put your finger on the end and holding with those two. You can hold it however you like. For me, it's like a little pencil grip. This is the best way I can explain it, okay? So you're gonna come in at a 45-degree angle. You're gonna puncture the skin, and then you're gonna puncture the vein. When you feel like you're in the vein, you're gonna drop down and advance just a millimeter more. You're gonna get that flash now. It's gonna be in. That's how you'll know that you are in the vein, okay? From there, you're going to push forward until it helps against the skin, and you're also simultaneously pulling back just slightly so that the needle is now in the plastic chamber like we talked about.
Is that a safety feature so you don't stab yourself?
Yes, it is. From here, you're gonna hold the pink part and you're going to twist that off, and it's gonna go in the sharps container. At this stage, you are continuing to hold the catheter. You are going to pop off your tourniquet and you're going to grab your extension set, okay?
Okay.
This is when we take the time and we pop off that. Notice I didn't touch it, I just touched the outside. It's now time to connect. So you take this tip, pull back.
Just the tip?
Well, you're not holding, yes, the tip goes in,
Okay.
You're not holding, you're pulling back on the spin part. Then you're going to spin it into each other and you'll kind of feel it lock. It won't be able to spin anymore.
Okay.
When you're ready, pull back. You'll get a little bit of blood return.
Okay.
There's air in this mannequin, so you can see an air bubble came. In reality, you don't want an air bubble. Then you're going to flush in solution. If you don't see any fluid starting to build around the vein or it doesn't start to get fat, you're in. The patient shouldn't experience any pain when you flush the saline. You can always warn them, hey, you might taste a little bit of salt water. From there, we're going to secure our IV. So you're going to take your Tachoderm and remove it from the backing, and then you are going to tape. Okay, secure the needle, and when you're ready and you feel like it's pretty tight, you can take off the paper. If the skin around the area is wet still, you're gonna have trouble getting the Tachoderm to stick. Okay, now from there, I unscrewed our sodium chloride solution. We don't need it anymore. And I'm going to further secure my IV. Personally, I tape with a V shape, leaving a little bit of space, an extra tug in case someone pulls on the needle, it won't come right out, or on the catheter really, because the needle is no longer in the patient. So this is just extra securing. You can do it any which way. This is just the way I prefer to do it. And then finally, secure it across the top like that. If you're patient and you're using a very vascular vein, if they have a high blood pressure or something, you might see some blood return start to happen. If that's the case and you're not using the IV at this time, you can pinch it off. Notice how it's fatter there and skinnier there.
Okay.
It pinches it off so you don't get any blood return.
Okay.
Does that make sense?
Yes.
All right, now I'm gonna go ahead and let you do it.
Okay, great. So I have a larger needle here. Does that really matter for this skill?
So the size matters when you're choosing a vein. So what I want you to do is choose.
Is it okay that I use a big one for this?
Yes.
Okay. All right. So I have my star pack, my flush, my extension, and my catheter.
Yep.
Open up my flush. Or my star pack. Prep my Tachoderm.
Yep.
Stretch out my tourniquet. Open up my chlorhexidine. And since I'm not going to use that, I'll just keep it in the boat.
That's okay.
All right, so I'm looking at the patient. I've already told them I'm going to start an IV. I've told them where we were going to put it. And this particular vein here looks really good. I think I'll use that, okay? So I am going to take my tourniquet just to make the vein pop. Put it under the patient's arm. I know this is tight. It'll only be on for a minute. So the tourniquet is on. Take the chlorhexidine. Clean the area really good. Okay, while that's drying, I'll prepare my tape and then my extension. Check my solution, make sure it is saline, and this is 0.9% saline, expires 5/27/22. Looks good. I don't see any floaties in there. My extension, it's in date as well. Try to get my air bubble out.
Good.
All the way to the top. Pull that down, loosen that up. Don't need to take the protective cap off. Grab my catheter,
Yeah.
which looks quite large. Pull my cap off.
Yeah.
Gonna hold it by the colored part.
Mm-hmm.
Just make sure it spins. It's not stuck on the needle. I don't see any burrs or anything. Okay, I think I'm ready. See my vein. Prep the patient. All right, you're gonna feel a stick on 3. Come in at a 45-degree angle. 1, 2, 3. In. Get flash. I'm gonna drop. Going just another millimeter or so, and then feed my catheter. This particular
Careful. Yeah.
doesn't have the safety tip on it. Oh, it did. It did pull the safety. Those are interesting. Into my sharps container. Okay. Gonna pop the tourniquet. This is a self-occluding catheter, so I don't have to hold.
You don't have to have proximal. I wouldn't necessarily recommend
Letting go
of
of
the
it?
color.
Okay.
Yeah.
So hold.
Just because your patient could move and they don't
Okay.
necessarily realize you haven't completed it, they could touch it on something.
Okay.
Yeah.
All right. Connect my flush.
Yeah.
And try and push some fluid in. Fluid goes in, draw back, fluid comes out.
Great.
All right, so we just get all the blood out of the line. We're good there. Take my Tegaderm. And it's secured there. We can pull our tape off now. Excuse me, our paper off now. Grab our tape. Stick it under, crisscross, crisscross. Piece here, disconnect my flush. Come across and
Wonderfully done. Any questions?
no, there's a little bit of return here. You said use this to lock it off?
Yeah.
Okay. All right, that's locked off. Excellent.
Wonderful job.
Thank you.
Turn it on.